Good morning, students.
Good morning,
Good
ma'am.
morning, ma'am.
Good morning, ma'am.
Good morning. So today we have one new student. No, actually two new students. Jayanti Bhattacharya ji or Megha. Can you unmute yourself and turn on your video? Hello.
Hello, good morning, ma'am.
Good morning. So this is your first day?
No, ma'am. I
No?
attend evening class.
Okay, so you are attending evening batch of
Yes,
Akshara.
ma'am.
Okay, no problem. And what about Jayanti? This is your first day? Am I audible to you? Miss Jayanti, can you please unmute yourself?
Yes, ma'am. Good morning.
Good morning. So this is your first day?
Yes, ma'am.
Okay. So right now we are doing F1 chapters. અત્યારે આપણે currently F1 chapter start કર્યું છે અને એમાં પણ vital signs chapter start થઈ ગયું છે. ગઈકાલે introduction initial vital signs પતી ગયા હતા. So today we will do revision of that initial vital signs અને પછી આગળ થોડું start કરીશું. So today there is only 1 hour lecture. So if you feel any query કે in between તમને doubt થાય છે નથી ખબર પડતી, so you can ask me in between. Okay. It might
Excuse
be
me, ma'am.
this is your first day તો થોડુંક તમને એવું થાય કે what is this, I don't understand. અમુક concept તમને નહીં ખબર હોય because this is your first day. But તમને કશું ના ખબર પડે કે આ કેમ આવશે, so you can ask me in between. Okay?
Excuse me, ma'am.
Yeah, okay.
Ma'am, excuse me, ma'am.
હા, sure.
Ma'am, I don't understand Gujarati, ma'am. Please speak in English.
Okay, no problem. I'll speak in English. Okay.
Okay, ma'am.
So
Thank you, ma'am.
from where are you? Where do you live?
From Jharkhand, ma'am.
Okay, you are from
From Tata Nagar. Tata Nagar.
Okay. So what is your mother tongue?
Bengali.
Bengali. Okay, no problem. So I'll make sure I don't speak in Gujarati. Okay.
Okay. Thank you, ma'am.
Okay. So let's start our today's lecture. Before moving to next topic, let's do a quick revision of our previous class. Yesterday, what we have completed?
Vital signs.
Vital
Vital.
signs.
Okay. What we have completed in vital signs?
Temperature, pulse,
Temperature,
BP,
pulse, BP.
respiratory.
Okay. So how many vital signs are there totally?
5.
5.
6.
Sure.
Yes.
CPR, BP. 6.
Okay. Okay. So there are 6 vital signs.
6 pain.
Okay. List all the vital signs.
Temperature,
Temperature.
pulse, respiration, blood pressure, oxygen, and pain.
Okay. TPR, BP, pulse oximetry and pain. There are 6 vital signs. So we have completed till now guidelines for measuring the vital signs. How you have to measure the vital signs, what you have to take care while measuring the vital signs, that we have completed. Then we have completed when to measure the vital signs. Whenever the patient comes to the hospital, before surgery, after surgery, before any procedure, after any procedure, before administering medication, during administration, after administration, before, during, and after blood transfusion. Whenever you feel any changes in the client's condition, or clients is stating to you that I am feeling uncomfortable, or I'm feeling something unwell, so at that time you check the vital signs of the patient. So till now we have completed when to check the vital signs or when to collect the vital signs. Then first vital sign that we have completed is temperature. What is the normal value of temperature?
97 to 99 degree Fahrenheit. In
Okay, and
Celsius,
what about Celsius?
36.1 to 37.2 degree
Yes.
Celsius.
Yes. So normal range of temperature in Fahrenheit is 97 to 99 degree Fahrenheit, and normal range of temperature in Celsius is 36.1 degree Celsius to 37.2 degree Celsius. You have to remember both values, because in questions sometimes they will give you the value in Fahrenheit, sometimes they will give you value in the Celsius. So you should understand that this is normal or abnormal. So you have to remember both values, their normal range in Fahrenheit or in Celsius as well. Okay, so we have completed what is the important topic about rectal temperature and oral temperature, something like that.
Rectal temperature higher 1 degree and
Okay,
axillary lower 1 degree
okay.
compared to
Only
over cavity or
oral cavity.
temperature.
Okay, so only axillary temperature is less 1 degree Fahrenheit less.
Tympanic and
Then
axillary.
Yes, tympanic is also 1 degree Fahrenheit less than the oral temperature. So the important point is rectal temperatures are usually 1 degree Fahrenheit higher than oral temperature, and tympanic and axillary temperatures are 1 degree Fahrenheit lower compared to oral temperature. So you have to remember this point. Okay. Then nursing consideration when you are taking the vital signs. What considerable points you have to keep in your mind while taking the temperature. So first of all, the time of the day. The time of day affects the body temperature. For example, in morning, the body temperature will be in lower range, and in the afternoon, the body temperature will be in higher range. So time of the day affects the body temperature. Then environmental or environment also affect the body temperature. Age, physical exercise, menstrual cycle, pregnancy, stress, illness, all these factors affects the body temperature of a client. Then the important point that you have to remember about not taking the temperature is, not getting the temperature is, what was that? If you are taking a temperature of a patient and you are not getting the right temperature, the temperature is in lower range, so what you will do, you will keep that patient as it is and you will document the normal range, or you will do something else.
Hypothermia.
Okay.
inform to HCP.
No, directly we cannot inform to HCP if you are taking temperature of a patient and you are not getting the right value. The temperature is in lower range, less than 97 degree Fahrenheit. So you have to take temperature twice or thrice to confirm, because there might be a risk of
Hypothermia.
hypothermia. Yes, if you are not getting the right temperature, the temperature is in lower range, so you cannot ignore that patient that the temperature is normal. We have no need to collect the temperature again. You have to check it twice or thrice to confirm the hypothermia, because there might be chance of hypothermia, and hypothermia is life threatening in very young and old clients. So so in pediatric client or in older clients, the hypothermia can be a life-threatening, can be fatal for them. So you cannot ignore a lower range of temperatures. You have to confirm it whether it is actually hypothermic or it's just any error of the thermometer or anything else. So you have to confirm it twice or thrice. Okay. Then how to measure the temperature? What is the important grade point that you have to remember? Whenever you get, for the new students, whenever you get the grade point in the PPT, that is so important point for you. You have to always remember these grade points. So what is that grade point, important point?
જે પણ ઇલેક્ટ્રોનિક ડિવાઇસ યુઝ કરે ને એનું મેન્યુફેક્ચરિંગ ઇન્સ્ટ્રક્શન આપણે પહેલા રીડ કરી લેવાનું.
Yes, whenever you are taking temperature of a patient, and whichever thermometer you are using, you have to read the manufacturer's instructions, how to use that device, what are the key points that you have to follow, how much time you will require to get the temperature. So you have to follow the manufacturer's instructions compulsorily. Then what are the methods of taking the temperature from oral cavity?
સબલિંગ્યુઅલી જે પ્રોબ ઇન્સર્ટ કરવાનું ત્યાં અને ટંગથી એને કહેવાનું કે કમ્પ્લીટ દબાઈ દે અને પછી લિપ્સ બંધ કરી દેવાના અને ત્યાં 1 મિનિટ સુધી રાખવાનું.
1 minute. You will keep the thermometer for 1 minute?
No.
મેન્યુફેક્ચરમાં જે ઇન્સ્ટ્રક્શન હોય એ પ્રમાણે.
Yes, you have to follow the manufacturer's instructions. Generally, we keep the thermometer for 2 minutes, but still you have to follow the manufacturer's instructions. How you will take the oral temperature? You will ask the patient to open the mouth and you will put the thermometer in the sublingual cavity, and we will ask the patient to lower their tongue to support the thermometer, and the patient will close their mouth by supporting the thermometer. We have to tell the patient that you cannot bite the thermometer. You just have to close your mouth through the lips. You cannot bite the thermometer. If the patient is having risk of seizures, can you take oral temperature?
No.
No.
No, we cannot take the oral temperature. Then what about rectal temperature? How you will take?
પહેલા તો પેશન્ટને સાઇડ લાઇન પોઝિશનમાં ઊંઘાડી દેવાનું.
Yes.
પછી જે બી થર્મોમીટર હોય સ્ટરાઇલ કરી દેવાનું. પછી અમ્બેલિકલની સાઈડ ઇન્સર્ટ કરવાનું એના બેકથી. અને ધ્યાન રાખવાનું કે 1.5 સેન્ટીમીટર ઇંચથી ઓછું જાય. અને જો
We
બેબી
can
હોય
cut up to 1.5 inches in adult, and
અને જો બેબી હોય તો 0.5 ઇંચથી વધારે ના જવું જોઈએ એની અંદર.
yes. So to take the rectal temperature, we will give sideline position. Generally, left sideline position is more preferable due to good circulation. So we will give the left sideline position and we will sterilize the thermometer, and then we will insert that thermometer into the rectum towards the umbilicus. We will move it further in the towards the umbilicus, and for the adult you have to move 1.5 inches, and in infants we cannot move more than 0.5 inches. So you have to remember this point also. In which conditions you cannot take rectal temperature strictly? The red point, that is important point.
કાર્ડિયાક ક્લાયન્ટ, ડાયરિયા,
Yes.
fecal infection and rectal bleeding.
Or who is at risk of bleeding. Okay, so can you take the rectal temperature in patient which who is having uh, inflammatory bowel disease?
No.
No.
We cannot take temperature in any client who is having inflammation or infection of the rectum, who is a cardiac patient, who has undergone rectal surgery, who is suffering from fecal impaction. What is fecal impaction?
Blocking.
Yes, blockage of the intestine due to the stool gets collected into the intestine. That is called as fecal impaction. Or who is suffering from rectal bleeding, or who is at risk of rectal bleeding. So in these patients, you cannot take rectal temperature in any conditions. You have to strictly avoid taking rectal temperatures. When you can take the rectal temperatures? Every time?
No.
So when you are taking the rectal temperatures?
When patient have a nasal congestion, undergone oral surgery, and had
Okay.
other jaws.
Only in the situations when we are not able to take oral temperatures, or we are not able to take temperatures via other methods like axillary, tympanic, temporal. Any method is not giving us accurate results. So in only that situation you will go for the rectal temperature. We cannot easily take the rectal temperature initially. First of all, we have to take the temperature through
Oral.
oral cavity. Yes, and if oral cavity from oral cavity we are not getting the accurate results, we will go for another methods, but we will keep the rectal measurement in last option. We will not directly jump to the rectal measurements. What about axillary temperature measurement?
Auxiliary હોય
Okay.
લેસ એક્યુરેટ હોય છે ઓરલના બીજા બધા કરતા.
Yes, it is less accurate as it is located outside the body. This and another, how you will take the axillary temperature?
Place
જે
in the
આમ હોય
client's
છે
dry
એના ઉપર
axilla.
શોલ્ડર ઉપર હેન્ડ મૂકી દેવાનો આમ અને પેશન્ટનો જે એક્ઝિલરી ભાગ હોય એમાં ઇન્સર્ટ કરવાનો.
Okay, the axilla should be
Dry.
Dry.
dry. Yes.
એને ડ્રાય કરી દેવાનો.
Yes, to take the axillary temperature, we have to make sure that the axilla of the patient is completely dry. If it is not dry, we have to make it dry and then we have to take the axillary temperature. We have to ask the patient to keep the hand on chest and cross their hands to another shoulder. And this is using this method, the patient can provide a good grip to the thermometer and we can take the temperature from the axilla. Okay, what about tympanic? How you will take the tympanic temperature?
જે થર્મોમીટર હોય છે ઓડિટરી કેનાલમાં ઇન્સર્ટ કરવાનું અને એમાં પહેલા ધ્યાન રાખી લેવાનું કોઈ ડિસ્ચાર્જ તો નથી આવતું, કોઈ ઇન્ફ્લામેશન છે કે નહીં, રેડનેસ છે કે નહીં, એ ચેક કર્યા પછી જ એનું ટેમ્પરેચર લેવાનું.
Yes. So in this image, you can see there is a thermometer for the tympanic membrane. You have to take the temperature from the auditory canal, the external auditory canal. Before taking the temperature, before inserting the probe into the auditory canal, you have to check the presence of redness, swelling, discharge, or any foreign body or any infection of the ear. If it is present over there, then we have to if the client is having redness in the ear. So can you take the tympanic temperature?
No.
Avoid.
Yes, we have to avoid taking tympanic temperatures. We cannot take tympanic temperatures if the patient is having any inflammatory disease condition, swelling, discharge, or any foreign body inside the auditory canal. What about temporal artery temperature? How you will take that?
Forehead.
Yes, we have to take the temperature from the forehead, and the forehead should be
Dry.
Dry.
dry. If the patient is diaphoretic, then what you have to do?
Just
Behind.
the yellow.
ઇયર
Yes, we
લોબના
can take
પાછળથી કરવાનું.
Yes, we can take the temperature by putting that probe behind the ear on the neck and exactly behind the earlobe. So we can put our probe there to take the temperature. But make sure your probe is touching the skin of the patient. Okay. From far, we cannot take the temperature. We have to make a skin to probe contact to get the accurate temperature. Okay, then a second vital sign that we have completed is pulse. What is the normal range of pulse?
60 to 100.
200.
200 beats per minute. If it is less than 60 beats per minute, then it is called as
Radical.
bradycardia. If it is more than 100 beats per minute, then it is called as
Tachycardia.
tachycardia. Yes. So we have completed nursing consideration that what factors do affect the vitals, that is the pulse, in which conditions the pulse rate becomes high, in which conditions the pulse rate becomes low, that we have completed till now. You have to remember this. You have to make sure that the concepts are clear, in which conditions the pulse becomes high, in which conditions the patient becomes patient experiences tachycardia or bradycardia. Then we have checked the qualities of the pulse. Make sure in questions you will only given 4 plus, 2 plus, or only names that the patient is having normal, easily palpable pulse, strong or bounding pulse. So you have to you have the knowledge regarding, you should have the knowledge regarding the grading scale for the pulses. What is the scale for normal, easily palpable pulse? What is the grade?
+2.
+2.
2. Okay, so that is the normal. If the patient is having 2 pulses, then it is the normal pulse. What about 4 plus pulse?
Strong and
Strong
bounding.
and bounding.
Yes, the pulses are very strong and bounding pulses. The patient is experiencing. What are the chances of having 4? Yes,
Hyper.
hypervolemia. Yes, fluid volume overload. There might be chances that patient is experiencing fluid volume overload. What about what is the grade for absent or not palpable pulse?
0 plus.
0.
0.
Only 0. Okay, so what is the quality of a pulse in 3 plus grade?
Full plus and
Full
increase.
pulse increase.
Full plus, and it is the pulse is increased. The patient is experiencing tachycardia. Okay, what about grade for weak, barely palpable pulse?
+1.
+1.
+1. Okay, so you have to remember the grade scale and the quality of the pulse according to that grade scale. Understood?
Yes, ma'am.
Okay.
Yes, ma'am.
We have completed the sites of the pulse. From which sites or location you can assess the pulse. So till now we have completed different sites. What are the sites? Can you list it all? From in the sequence from head to toe, you have to list all in sequence.
Temporal.
Then
femoral,
Femoral.
Carotid.
Carotid,
carotid,
okay. Then
brachial,
Brachial.
Breaks.
Radial.
Radial.
radial,
Pleural.
radial and
Femoral.
ulnar, femoral,
Femoral.
then
Popliteal.
Poplite.
popliteal, then
and
fossa,
dorsal peris,
at the ankle,
dorsalis peris,
at
Posterior.
the
Posterior.
ankle,
Posterior.
posterior, yes,
posterior
posterior
tibial,
tibial, and on the foot,
Dorsal pedal.
Dorsal.
dorsal
dorsalis
pedis,
pedis. What is the pulse that we take at the chest?
Apical.
apical,
Okay, so you have to know this the sides of the pulse and always try to remember in sequence. So you will not forget any pulse. So always, whenever I'm asking you something, you have to always give answer in the sequence. So you cannot skip any pulse or any site. Okay. Then what is the important rate point about apical pulse?
fully 1 minute ఉంది લેવાનો હોય છે.
When? When you have to take the apical pulse for full 1 minute?
Irregularly જમાય જ્યારે તમે
Irregular
રેડિયલ
radial
થી માપતા
pulse.
હોય ત્યારે.
Okay, if the patient is experiencing irregular radial pulse, you have to take the apical pulse, but not for 30 seconds. You have to take the apical pulse for 1 full minute. And if the patient is, you are supposed to administering the cardiac medications like digoxin, beta blockers. And if the patient is younger than 2 years, then you, in these situations, you have to always check the apical pulse, and that is also for 1 full minute. You cannot check the pulse for 30 seconds, and you cannot multiply by 2. You have to check for 1 full minute. Okay, next, what is pulse deficit?
જ્યારે પેશન્ટનો એપિકલ પલ્સ ચેક કરીને એટલે જે પેરિફેરલ પલ્સ હોય ને એ ઓછા આવે. Deficit.
Okay, the peripheral pulses are less than the apical pulse. So the patient is experiencing bradycardia?
No.
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 No, there is the problem in the peripheral circulation. The apical pulse are okay, that is in the normal range, but the peripheral pulses, that is the radial, femoral, ulnar, any pulse, the peripheral pulses are in the lower range. Though that is this situation, this condition is called as pulse deficit. There is a difference between bradycardia and pulse deficit. In pulse deficit, only the peripheral pulses are less than 60, but the apical pulse is in the normal range. And in bradycardia, whole peripheral or central apical pulse is less than 60. Okay, so how you will take the pulse, or how you will assess the pulse if the patient is pulse deficit?
There are two.
One examiner technique, two examiner technique.
Okay, so there are two methods of taking the pulse in a pulse deficit patient. One examiner technique and two examiner technique. What about one examiner technique?
એમાં પહેલા એપિકલ પલ્સ લેવાનો
Apical pulse first, then
હજી રેડિયલ પલ્સ લેવાનો
radial
immediately.
pulse.
Okay, so the examiner will take the apical pulse first, and immediately after taking the apical pulse, the examiner will take radial pulse, and the examiner will compare that the radial pulse are decreased or normal. If it is decreased, then we have to inform
Yes.
PSCP that the patient is suffering from pulse deficit. What about two examiner technique?
એક જ ટાઈમે
One
બંને
examiner.
લેવાના.
Okay, there are two examiners. One examiner will take the apical pulse, and second examiner will take the radial pulse,
Radial
and
pulse.
both will compare about the pulse rate. Okay, then the third vital sign is respiration. What is the normal range of respiration?
12 to 20
20
beats
to
per minute.
20.
Yes, 12 to 20 breaths per minute. This is also BPM. If it is less than 12, then
Bradypnea.
bradypnea, and if it is more than 20, then it is called as
tachypnea.
Yeah. So we have till now completed nursing considerations while taking the respiratory rate of patients. What key points you have to keep in mind? Which conditions, in which situations the patient will experience bradypnea, in which situations or conditions the patient will experience tachypnea. You have to remember these key points. You have clear knowledge regarding this. Then how you will assess the respiratory rate? How you will check the respiratory rate of patient?
Count it for 30 seconds and multiply by 2.
Okay, you can take respiratory rate for 30 seconds and just simply we can multiply it by 2. But if the patient is ill or patient is having any respiratory conditions or patient is experiencing irregular respirations, in that case we have to take,
Counted for
1
1.
full minute.
yes, we have to
Fully
take the, yes, we have to assess the respiratory rate for 1 full minute. We cannot just take it for 30 seconds. But how you will assess the respiratory rate? My point is that
જ્યારે પલ્સ
how,
ચેક એ ટાઈમે જ રેસ્પિરેશન ચેક કરી લેવાનું 1 ઇનહાલ ને એક્સહાલેશન ને 1 રેસ્પિરેશન.
okay, after completing the assessment of pulse rate, you have to keep your hand as it is. You have to hold the hand of patient and keep the patient's hand on their chest, and you have to assess the chest movement. One inhalation and exhalation is the one respiration. So we have to count the respirations, how many times the patient's chest is expanding and relaxing. So after assessing that, you can identify the respiratory rate of patient. Okay, next vital sign that we have completed is blood pressure. What is the normal blood pressure?
120
less.
120 mm, 80.
Less than 120 mm of Hg and less than 80 mm of Hg. 120 is systolic, 80 is
diastolic.
diastolic. Okay. So we have categories for the blood pressure. Tell me about the categories. What is normal, what is elevated, what is stage 1, what is stage 2, and what is hypertensive guys.
Normal હોય less than 120/80 હોય.
Okay.
એલિવેટેડ હોય ને એનું સિસ્ટોલિક હોય ને એ 120 થી 129 હોય અને ડાયસ્ટોલિક હોય એ લેસ ધેન 80 હોય.
Okay.
પછી સ્ટેજ 1 માં હોય ને તો એનું સિસ્ટોલિક હોય એ 130 થી 139 ની વચ્ચે હોય અને ડાયસ્ટોલિક હોય એ 80 થી 89 ના બિટવીન હોય.
Yes.
ટુમાં જે સિસ્ટોલિક હોય એ 140 હોય અને ડાયસ્ટોલિક હોય એ 90 હોય.
Okay.
અને હાઇપરટેન્સિવ ક્રાઇસિસ હોય તો એમાં સિસ્ટોલિક હોય એ 120 થી અપ જતું રહે અને ડાયસ્ટોલિક હોય 120 હોય.
Systolic 120 થી up
180.
ઓ 120 જેટલું થઈ જાય.
180. Okay.
હા 180.
Yes. So you are correct. The normal blood pressure is less than 120/80 mm of Hg. When we can say the patient's blood pressure is elevated. So the systolic, there is a range. The systolic blood pressure will be in between 120 to 129 and diastolic will be still less than 80 mm of Hg. So in these cases, you can say that the patient is having elevated blood pressure. You cannot say that the patient is having hypertension. You can simply suggest the patient is having elevated blood pressure. Then stage 1 hypertension. In which situation you can say the patient is having stage 1 hypertension. So the systolic blood pressure will be in between 130 to 139 mm of Hg and the diastolic blood pressure will be in between 80 to 89 mm of Hg. When we can say the patient is having stage 2 hypertension, so the systolic is at least 140. It can be more than 140, but not less than 140. It must be at least 140. Then and then you can say the patient is having stage 2 hypertension and the diastolic is at least 90 mm of Hg, not less than 90. If it is less than 90, then which condition is there? If the patient is having blood pressure less than 90, diastolic.
Hypotension.
So
Stage 1.
સ્ટેજ 1 માં જતું રહેશે.
stage 1 hypertension, but for stage 2 the blood pressure must be at least 90. And what about hypertensive crisis? The systolic blood pressure is over 180, more than 180, and the diastolic blood pressure is more than 120. So these are the categories. You have to remember all these categories. In the questions, you will be only given the names, like the patient is having stage 2 hypertension, stage 1 hypertension, elevated blood pressure. So you should understand what will be the blood pressure of the patient, and sometimes they will only give you the range. So from that range you have to understand which condition is the patient experiencing. Is it elevated, stage 1, stage 2? So you have to remember all these categories. Then we have completed the guidelines and nursing considerations. Which factors affects the blood pressure of the patient, in which conditions the blood pressure becomes high, in which conditions the blood pressure becomes low. So you have to keep these points in mind. Then guidelines for measuring BP. You have to follow some guidelines how to measure the BP. You have to avoid in some situations, like in which situations you will avoid taking BP in specific extremity. If the
IV લાઈન લગાડ્યો એ હાથે નહીં લેવાનું.
yes, if the patient is having B line, so in that extremity,
Fistula.
fistula, okay, then
mastectomy કરી હોય જે extremity side છે.
yes, the patient has undergone mastectomy surgery, so you cannot take the blood pressure in that extremity. If the patient has undergone left mastectomy, you cannot take blood pressure in the left arm. Then if the hand is injured,
Traumatized.
yes,
Injured.
traumatized, diseased or anything, so you cannot take the blood pressure in that extremity. If the both arms are injured, so you can take blood pressure from
Leg.
Leg.
legs. Yes, same as the head, you can also take blood pressure from legs also. Okay. So we know how to take the blood pressure. We have to first tie up the cuff very snugly. You cannot make it over tightly or loose fitting. You have to snugly fit the BP cuff and inflate the BP cuff. Before tying up the cuff, you have to deflate it. After tying up the cuff, you have to inflate it. And while releasing the air from the cuff, you have to auscultate the sound. The first sound is called as
Systolic.
systolic blood pressure. And the second stopping of the sound is called as
Diastolic.
diastolic blood pressure. So you have to record it. What is the important read point that you have to remember?
Appropriate cup size.
Yes, if the cuff size is too small, then
Also,
એ
Falsely high
reading
reading.
increase कर दे.
yes, falsely high reading. There will be falsely high reading. If the cuff is too large, then
Decrease कर दे जे भी रेटिंग हो.
it will cause the readings too low. Okay. So any doubt till this?
No.
Okay. So let's start.
મેડમ કાર્ડિયક સર્જરી કરાઈ હોય તો બી લેફ્ટ સાઈડ થી લેવાય બીપી.
Yes, huh? We can take the BB from the left side. Okay. Any other doubts?
No.
Okay. So let's start the next vital sign, that is pulse oximetry. What is the normal range of pulse oximetry? SpO2?
95 to 100.
Yes, it should be always greater than 95. If it is less than 95, then the patient is experiencing
hypoxia.
Hypoxia.
Yes, but there are some situations, considerations you have to keep in mind. We will study further. So let's see the description first. Pulse oximetry is a non-invasive test that registers the oxygen saturation of a client's hemoglobin. Make sure the oxygen, where do we find oxygen in our blood? Where is the oxygen located in our blood?
In
In
hemoglobin.
artery.
In the hemoglobin inside the RBCs. Oxygen binds with the hemoglobin, and through that hemoglobin, the oxygen is delivered to the cells. If the patient is anemic, the oxygen saturation will be
Decrease હોય છે.
less. Yes, because there is not enough of hemoglobin to carry that oxygen to the cells. So the oxygen always binds with the hemoglobin, and the oxygen saturation that is bind to the hemoglobin, we are checking that only through the pulse oximetry device. The capillary oxygen saturation, that is SaO2, is recorded as a percentage, and the normal value is 95% to 100%. After a hypoxic client uses up the readily available oxygen, measured as the arterial oxygen pressure, that is PaO2 on the ABG. What is the normal value of PaO2?
80 to 100.
80 to 100.
80 to 100. The reserve oxygen, that is oxygen attached to the hemoglobin, is drawn on to provide the oxygen to the tissue. Okay, so this point is telling us that uh, we are not measuring the oxygen that is readily available by the tissues. That is called as PaO2. The whole oxygen that is available for the tissue, that is PaO2. But after the consumption of oxygen that is available in the blood, the remaining oxygen that is attached to the hemoglobin, that is called as SaO2, and we are measuring that. We are not measuring the PaO2. The PaO2's normal range is different and SpO2's normal range is different. Understood what I'm trying to say?
Yes, ma'am.
Okay, so there are two types of students: those who do not get a clear idea about the concept in English. You can tell me, I will translate into Gujarati. And for the new student that do not understand the Gujarati, you can also tell me. If I'm making understand in Gujarati, you can tell me to repeat in English. I'll make you understand both. Okay.
Yes, ma'am.
Okay, next, a pulse oximeter reading can alert the nurse to hypoxemia before clinical signs occurs. While taking the SpO2 of the patients, we can get the idea, we can alert ourselves before the hypoxemia of clinical signs. Like if the SpO2 is 94, 93, we can identify the patient is experiencing hypoxemia before having any sign and symptoms. So we can give the oxygen, we can just give the semi-Fowler's position, or we can advise the patient to take deep breaths. We can start O2. So through the SpO2, we can get the idea about hypoxemic status of the client before having any sign and symptoms to the patients. If the pulse oximetry readings are below normal, instruct the client in a deep breathing technique and recheck the pulse oximetry. If you are taking a SpO2 of the patient and the readings are low, less than 95, so what you will do? You will ask the patient to take the deep breaths. You will teach them about deep breathing techniques. You will tell the patient, take deep breaths, and then you will check the SpO2 again. You have experienced this in the hospital settings. Whenever you are taking the SpO2 and if it is less than 95, you will tell the patient, okay, take deep breaths, and then you will assess again. If it is now in the normal range, then there is a no problem. But if it is low, you have to first try to improve through the respiratory technique, breathing techniques. Next, nursing consideration that you have to keep in mind regarding SpO2. A vascular pulsatile area such as fingertip or earlobe is needed to detect the degree of change in transmitted light that measures the oxygenated and deoxygenated hemoglobin. You have to always keep in mind where you have to attach that pulse oximetry probe. You have to always check the SpO2 from the highly vascular pulsatile area. For example, the fingertip, earlobe, nose, toes of the legs. You can attach the probe to this side to get the SpO2 levels. Oh, okay. Factors that affect light transmission also affects the measurement of SpO2. You have seen the pulse oximetry probe. Have you seen that pulse oximetry probe?
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
There is one light that is always
Red.
on when you are taking the SpO2. So if the light is not transmitting into the fingers, into the arteries, the readings will be false. So make sure that the light which is transmitting is effective. If the patient is having nail polish, then the full light cannot enter into the finger near to the vessels, near to the arteries, and the reading will be less. False reading will be there. Some factors that affect the light transmission can include the sensor movement, finger nail polish, hypotension, anemia, or peripheral vascular disorders. If the patient is having such conditions, the SpO2 will be less than 95. If the patient is moving their fingers, then also the light will get affected and we cannot get the accurate measurement. If the patient has done fingernail polish, then also it will affect the SpO2. If the patient is suffering from hypotension, there is not enough volume of blood, RBCs, and lack of RBCs leads to lack of hemoglobin and less SpO2 reading. If the patient is anemic, then also there is lack of hemoglobin, which affects the SpO2 value. And if the patient is having peripheral vascular disorders, there is no proper blood supply to the fingertip. So in this situation, you will get the false readings. How to take the SpO2? What is the procedure? How to take the SpO2? Tell me.
જેમ તમે કીધું ફિંગર પર કે તો નોઝ કે ઇયર ઉપર એને એપ્લાય કરો.
Yes, we have to attach the probe to the highly vascular area, and the easily accessible area is the fingertip. A sensor is placed on the client's finger, toe, nose, earlobe, or forehead to measure the oxygen saturation, which then is displayed on the monitor. We cannot use that probe, which is like popping probe. એ આપણે forehead પર ના મૂકી શકીએ because એ open ના થાય. એના અલગ આવે. Forehead ના probes અલગ આવે, just like temperature gun. Forehead ના જે probes હોય એ different હોય. આપણે જે regular probes use કરીએ છીએ એ forehead પર ના મૂકી શકાય. That is not possible. So these are the different places where you can measure the SpO2. Do not select an extremity with an impediment to blood flow or that is cold in the temperature. Yes, make sure the site you are selecting for the SpO2, it should not lack in the blood supply. The blood flow should be very good at that extremity, and if the extremity is cold, so you cannot take the temperature. You have experienced this in the hospital settings. While the patient in winter season, especially the patient's extremity is cold, so what do? We ask the patient to rub their palm so the extremity gets warm and we can get the accurate results. So cold fingers alter the results of SpO2. The important red point that you have to remember is a usual pulse oximetry reading is between 95 to 100. A pulse oximetry reading lower than 90 necessitates PSCP's notifications. Values below 90 are accepted only in certain conditions. Agency policies and procedures, agency procedures and PSCP's prescriptions are followed regarding the actions to take for the specific reading. Let me explain you this. What is the normal range? It should be between 95 to 100. If the pulse oximetry reading is less than 95 but more than 90, what you will do?
નોટિફાઈ ટુ પીએચસી.
No. PHCP's notification is less than 90. But if the pulse oximetry reading is between 90 to 95, then what you will do?
deep breath કરો અને સેમી ફાઉલર પોઝિશનમાં બેસો.
Yes, we will improve the breathing techniques. We will give the sitting position or we will tell the patient to inhale deeply. Deep breathing techniques we will advise to the patient. After doing this, still the SpO2 is not increasing, then you have to notify the PHCP. But you are taking the pulse oximetry and it is directly less than 90. So you cannot wait for the deep breathing techniques. You just simply have to notify the PHCP. In some situations, you can accept less than 90. For example, if the patient is having COPD and you are checking the SpO2 of that patient, SpO2 is 88. What you will do?
It is acceptable.
Acceptable.
Acceptable, yes. You will simply document. So in questions, they will ask you such things. Don't get confused that the 89 is less than 90. We have to do something. No. See the patient. Patient is having certain chronic conditions. In these chronic conditions, there might be chances that the pulse oximetry is always less than 90. So you have to simply just document that it is 88 percentage. So in such situations, you can accept less than 90% SpO2. Understood?
Yeah.
And you have to always follow the policies and procedures of that hospital. In hospitals, if it is mentioned that in chronic condition, if the patient's SpO2 falls below 85%, you have to notify the PHCP. So in these situations, you have to notify if it is less than 85. And in some agencies, they will mention that if it is less than 80, then you have to mention the PHCP, notify the PHCP. So always follow the agency's procedures and policies. But in examination, you have to simply remember this point. If it is 95 to 100, simply document. If it is less than 95 and more than 90, so you have to improve the breathing of the patient. If it is less than 90, then you have to notify the PHCP. In some situations, in some chronic condition, it is acceptable less than 90%. Understood?
Hmm.
Okay. Next, uh, next that is pain. Last vital sign is pain. So let's assess the types of pain. Let's study the types of pain. There are mainly 5 types of pain. First is acute transient pain. What do you mean by acute transient pain?
એ આમ તરત થતો યુઝ્યુઅલી હોય.
Yes, due to any injury or anything sudden, the pain experienced by the client, that is sudden, and for the short period of time, that is called as acute or transient pain, usually associated with an injury, medical condition, or surgical procedure that lasts hours to few days. After a few days, the pain will get vanished. The pain will get reduced. So that is called as acute pain. It will not long last for more than months or years. It is for the short period of time. That is called as acute pain or transient pain. What is chronic persistent non-cancer pain?
Long term pain આવે.
Yes, but it is non-cancer.
You.
The patient is not having the cancer. It is for the long-term pain, but persistent. The pain is persistent, continuous, but the patient is not having the cancer. So it is non-cancer pain, usually associated with the long-term or chronic illness or disorders, may continue for months or even years. The pain will not reduce over the years also. So that pain is considered as a chronic pain or persistent non-cancer pain. Next is chronic or episodic pain. What is that?
એપિસોડમાં
Long
આવતો
term
હોય
હશે.
પેન આમ.
Yes. The patient is experiencing, for example, if the patient is having problem of migraine from the long time, but in during certain intervals, the patient will experience the pain. That is the episodes. But after the episodes comes for long time. એવું નથી like for example પેશન્ટ આજે કોઈને માઇગ્રેન આવ્યું છે માઇગ્રેનનું પેઇન થયું થોડાક ટાઈમ સુધી ચાલ્યું પછી થોડાક 2 દિવસ પછી ફરી માઇગ્રેનનું અટેક આવ્યું સો લોંગ ટાઈમ સુધી એ વચ્ચે વચ્ચે એપિસોડ્સ આયા કરે. That is the chronic episodic pain. Occurs sporadically over an extended period of time. Pain episodes last for hours, days or week. જે episodes છે, the episodes of the pain will last for hours, days and weeks. Example are migraine headache and pain related to sickle cell crisis. These patients experience the pain in episodes and the pain will for the long lasting time. So that is called as chronic episodic pain. Next is cancer pain. What is that? Cancer pain?
ટ્યુમરના કારણે આમ થતો હોય ને પેઇન આમ.
Yes, the patient is experiencing pain related to the illness, related to medications therapy like chemotherapy, radiation therapy. So all this pain is considered as a cancer pain. And again, it is chronic. It is not acute. The patient will experience the pain for over longer time. Not all individuals with cancer have pain. Yes, it is also fact. દરેક ઇન્ડિવિજ્યુઅલ જે કેન્સરસ છે દરેક ઇન્ડિવિજ્યુઅલને પેઇન ના થાય. It is not possible that every individual will experience the pain. Some have acute or chronic pain. Some patient will experience pain for only short time and some patients will experience pain for the long time. Cancer pain is usually caused by tumor progression and related pathological processes, invasive procedures like biopsy, tissue sampling, all that. Treatment toxicities, infection, physical limitations, all are the reasons for causing the cancerous pain. Idiopathic pain. What is idiopathic pain?
ખબર ના પડે કે આ પેન થાય છે પણ પેન ચાલુ જ રહે.
જે અનનોન છે.
The cause of the pain is unknown. Yes, we cannot identify why the pain is having or why the client is experiencing the pain. That is called as idiopathic. This is a chronic pain in absence of an identifiable physical or psychological cause. We cannot identify the cause. Patient is experiencing pain. Patient will tell you that I am having pain in the leg, but why? What is the cause for having pain in the leg? We cannot identify that. Or pain perceived as excessive for the extent of an organic pathological condition. The person will experience the excessive extent of the pain, but the cause, we cannot identify the cause. So these are the types of pain. There are 5 types of pain: acute or transient pain, chronic, persistent, non-cancerous pain, chronic, episodic pain, cancer pain, or idiopathic pain. Then assessment. How you will assess the pain? Okay, let's complete this assessment. How you will assess the pain of a patient? Tell me. How you will assess the pain?
સ્પેશિયલ સ્કેલ થી.
Yes, there are special pain scales to assess the pain. So first assessment in the in that first point is pain is highly individual experience. Every individual will tell uh, will express the pain differently. If I ask someone, tell me about the severity of pain, someone will tell that I'm having severe pain. Someone will tell that I'm having mild pain. Not every individual will experience the same kind of pain. So it is individual experience. Every individual has different experience related to pain. Ask the client to describe the pain in terms of timing, location, severity, quality, aggravating and precipitating factors, and relief measures. While assessing the pain, you have to question the patient in terms of timing. At what time you are getting the pain? Like in the morning, in the afternoon, the patient specifically for the chronic episodic pain, the patient will tell you that in every day in the morning I get the migraine headache. So that is the time. Location, where you are experiencing the pain, in head, hand, back, stomach, legs, anywhere on the body. What is the location of the pain? What is the severity? That is mild, moderate, severe pain. What type of pain you are experiencing? What is the quality of pain? What do you mean by quality? Quality means?
Mild, moderate.
સ્ટ્રેન્થ આવે ને એવું.
No, that is the severity. Mild, moderate, severe, that is the severity of pain. Quality of pain, that is cramping pain, stabbing pain, aching pain. There are different types of pain. ચૂંક આવે છે, પછી આપણે નથી કહેતા પલ્સેટિંગ પેનને શું કહેવાય, લબકારા મારે છે. કેવા ટાઈપનું પેન થાય છે? What is the quality of pain? Whether it is stabbing pain, throbbing pain, pulsating pain, aching pain, dull, what is the quality? So you have to also ask the quality of pain. Aggravating, what is the aggravating means?
પેન ઇન્ક્રીઝ થાય
ટાઈમ
છે.
સાથે વધે.
Yes, કઈ એવી reasons છે? What are the causes જેના લીધે એ pain વધે છે? What are the aggravating factors? Aggravating factors means the reasons which leads to increase in the pain. There is a pain, but these reasons increases the pain. So that is the aggravating factors. What is precipitating factors?
ડ્યુ ટુ સમ
Heredity.
ફેક્ટર્સ એન્ડ પેન થશે.
Yes, there is no pain, but due to some reason, the pain initiates. That is called as precipitating factors. જે reason ના લીધે pain start થાય છે. Aggravating એટલે pain already છે, increase થાય છે. That is called as aggravating. પણ pain નથી અને કોઈ reason ના લીધે start થાય છે. That is precipitating factors. So you have to also ask about aggravating factors, precipitating factors, and relief measures. You have to ask the patient what you usually do to relieve that pain. So relief measures, you have to also ask the patient. Ask the client about the use of complementary and alternative therapies to alleviate the pain. You have to tell the patient to use the complementary and alternative therapies like acupressure, acupuncture, guided imagery, music therapy, any alternative therapies to eliminate that pain. Pain experienced by the older client may be manifested differently from the pain experienced by members of other age group. We know that pain is individualized. So whenever you ask the old client about the pain, they will manifest it differently. They will tell you exaggerating that pain. They will tell you that I am having so much of pain compared to the adults. બીજા એજ ગ્રુપના મેમ્બર્સને પૂછો તો એ લોકોનો એક્સપિરિયન્સ અલગ હશે, ઓલ્ડર એડલ્ટ્સનો અલગ એક્સપિરિયન્સ હશે. Why? For example, sleep disturbances. In old age, the patient will experience sleep disturbances, change in the gait and mobility, decreased socialization, depression. These are the reasons. That's why the pain is manifested differently compared to other age groups. Clients with cognitive disorder. If the person is having other cognitive disorders, then you will ask about the pain. They will tell you something different. For example, client with dementia or a comatose client may not able to describe their pain experiences. If the patient is in coma, patient can describe their pain? No, they cannot describe their pain. If the patient is having dementia, they will not remember about the pain. So this also affects the assessment. The nurse should be alert to non-verbal indicators of pain. We have to identify the non-verbal indicators of the pain. What are the non-verbal indicators? How you will identify the patient is experiencing pain? If the patient is comatose or patient is unconscious, so how you will identify the patient is experiencing pain?
फेस ऊपर दिया
Right.
मैंने कि
Facial expression.
Yes, facial expressions, body image થી આપણને identify થશે. So let's see the non-verbal indicators of pain. So first is moaning. What is moaning?
બૂમો પાડવી.
On the
No, patient will create some noise like pain, like કેવું એને પેન થતું હોય તો કેવું abnormally એવું moan કરે. That is called as moaning. બૂમો નહીં પાડે. બૂમો પાડવું is different thing. Moaning એટલે ખાલી sound create કરે. Crying, patient will cry. The patient will be irritable, restlessness, grimacing or frowning. Grimacing means the lips will drop down. That is called as grimacing. So patient, you can see the facial expression and you will find out the frowning or grimacing. Inability to sleep due to the pain, rigid posture. Whenever the patient is experiencing pain, the patient will become rigid. They will not move their extremities. Increased blood pressure, heart rate, and respiratory rate. We know the pain increases the blood pressure, heart rate, and respiratory rate. So through that, you can also identify nausea, diaphoresis, and next is use of FLACC scale, that is face, legs, activity, cry, and consolability. This scale is for the pediatric client. And scales of faces pain scale for the appropriate for children, for clients who cannot communicate their pain verbally. The scales are scored in the range 0 to 10, with 0 representing no pain. You can also check these scales, FLACC scale and faces pain scale. Through this scale, you can identify the pain in the patients who cannot verbally tell about their pain. You can see in the image there is one scale, faces બનાયેલા છે. In that scale, you can see there is 0 to 10 score, and 0 is for no pain, 10 is for severe pain. So from looking at these faces, you can easily compare the client's face and the pain scale's face, and you can assess the pain level of that patient. So these are the non-verbal indicators. Verbal indicators means the patient will tell you about their pain, how the pain is mild, moderate, or severe. So patient will verbally tell you about their pain. Ask the client to use a number-based pain scale. A picture-based pain scale is commonly used in the children or client who cannot verbally describe their pain to rate the degree of pain. You have to always ask the client in number. For example, I am assessing a pain of my patient. So I will ask my patient from 0 to 10, how much pain you are experiencing. If the patient is having severe pain, then patient will tell you I am experiencing 9 or 10 amount of pain. If the patient is having mild pain, so patient will tell you I'm experiencing 1 or 2 number of pain. So you have to ask in number. For this is for verbally expressing the pain. But the patient is not able to express the pain verbally, or the patient is pediatric. So you have to check the picture based scale, that is face pain scale. So you can see in this image, there are four scales actually. One is in number 0 to 10. This describes no pain to severe pain. The patient will tell you the number that I am experiencing this amount of pain. Second is descriptive pain. You will ask the patient, there is no pain, mild pain, moderate pain, severe pain, and unbearable pain. If the patient says, I am experiencing moderate pain, so you will circle the moderate pain. Next is visual analog. Visual analog means you have to check the patient. You have to visualize the patient, what the pain is experienced by the patient, and you have to mark in between and write it. That patient is experiencing severe, moderate, mild kind of pain. And last is faces pain scale. Through the facial expressions, you can identify the patient is experiencing no pain, little bit, little more, even more, whole lot, or worst pain. So from this, you can assess the pain level of the patient. Understood?
Yes.
Understood? Okay. Next is evaluate the client response to non-pharmacological interventions. Always you have to go for the least invasive, then more invasive, and always non-pharmacological method first, then pharmacologicals. So if you are telling the patient about alleviating the pain through non-pharmacological methods like complementary or alternative therapies, so you have to evaluate the client for the response, that using these complementary methods or alternative methods, does your pain gets reduced? So you have to check the response to the non-pharmacological methods. The important point, red point that you have to remember is consider the client's culture and spiritual and religious belief in assessing the pain. Some cultures frown on the outward expression of the pain. Yes, keep this in mind. You have to always consider the client's culture, spiritual, and religious belief regarding the pain. In some cultures, the people will express their pain so loudly, and in some cultures, they have been taught that pain is good thing. You cannot express your pain in such a manner, so they will say I am having no pain. ફોર એક્ઝામ્પલ ઇન મૂવીઝ તમે જોયું હશે કે અમુક નહીં કહેતા કે આટલું પેન તમને કશું ના થાય, ધીસ ઇઝ નથિંગ ફોર મી. સો એ લોકો લેસ એક્સપ્રેસ કરે, અને અમુક કલ્ચર્સમાં થોડુંક બી પેન હોય ને તો એ લોકો બહુ જ લાઉડલી એક્સપ્રેસ કરે, લાઈક બહુ જ સિવિયર પેન થાય છે. સો always you have to consider this in your mind, their culture, their spiritual beliefs, their religious beliefs, because this will impact the expression of pain. Understood?
Yes.
Okay. So this is it for today's lecture. So today we have completed two more vital signs, that is pulse oximetry and pain. What is the normal range of pulse oximetry?
95 to 100.
95 to 100. Then nursing considerations. Which factors leads to decrease SpO2 reading and which factors leads to increase SpO2 reading? You have to keep that in mind. Then how you will take the SpO2. So you have to place the probe in highly vascular area. It can be either finger, toe, nose, earlobe, or forehead to check the SpO2 level of the patient. Make sure the extremity which you are selecting should not be in cold temperature, and there must be a good blood circulation to that extremity. The red point that you have to remember is, what is the red point that you have to remember for SpO2?
Normal
95 to
pulse
100 હોય
oximetry.
નોર્મલ, અને
Yes.
95 થી ઓછું હોય અને 90 સુધી હોય તો એ આમ એના માટે કોઈ જાણ નહીં કે એનું
Chronic
સેમી ફાઉલર
condition.
પોઝિશન આપવાનું અને એનું ડીપ બ્રીથ કરે. બટ જો
Okay.
90 થી ડિક્રીઝ થાય તો આપણે પીએસએપી ને તરત જ ઇન્ફોર્મ કરવાનું હોય. અને અમુક કન્ડિશન્સ હોય જેમાં એક્સેપ્ટેબલ હોય છે, જેમ કે
Yes.
સીઓપીડી ને એમાં.
Yes, some chronic conditions. Okay. So normal reading is 95 to 100. If it is between 90 to 95, you have to simply improve the breathing techniques of the patient and then you have to recheck the SpO2. If it is lower than 90, you have to notify the PHCP. In some conditions, chronic conditions like COPD or if the patient is having asthma attack. So in that chronic conditions, less than 90 readings are acceptable, but always follow the agency's policies and protocols for regarding the actions, what you have to do in certain readings. Always follow the agency policies and procedures. Last vital sign that we have completed is type pain. So there are types of pain. How many types of pain are there?
5.
Acute, chronic episodic, cancer, idiopathic.
Idiopathic pain. I'll ask you tomorrow what is acute pain, chronic, persistent non-cancerous pain, chronic episodic pain, cancerous pain, or idiopathic pain. You have to just remember it. They will not ask you in the exam what is idiopathic pain, but you should have the knowledge related to this. What is acute, what is chronic. Okay. Then assessment. How you will assess the pain? First of all, pain is individual experience. Not every individual will express the pain in same manner. Then you have to ask about,
Location, timing,
yes, location,
quality,
timing, quality,
quality,
then
severity,
severity, aggravating factors, then
precipitating
Precipitative
factors,
factor.
precipitating factors, then
Relief
relief
measure.
measures
relief
used
measure,
by the patient. Yes, you have to also ask this. You have to suggest some complementary therapies to eliminate that pain. Make sure in mind that older adult will experience pain in different manner compared to other age group person. Cognitive disorders, the client with cognitive disorders may not able to describe their pain due to their cognitive disorders only. Then if the patient cannot express the pain verbally, so what you will do?
Numerical
non-verbal,
measure,
Yes, you
non-verbal.
will go for the non-verbal indicators, the vitals like blood pressure, heart rate, respiratory rate, and through their body images like facial expression changing, crying, moaning. All these are non-verbal indicators. What are the scale for non-verbal indicators of pain? Which scales you can use?
facial expression,
Yes, facial pain scale, and there is another scale for the pediatric client, that is FLACC scale. You can search on Google about FLACC pain. You will find the table like Apgar score for children. So similarly, there is FLACC scale for the pediatric client and also for those clients who cannot express their pain verbally. So the important point that you have to remember is while assessing the pain,
કલ્ચર અને સ્પિરિચ્યુઅલી એને કોઈ હાર્મ ના થવું જોઈએ.
no. We are not talking about harming. You have to consider the patient's cultural, spiritual, and religious belief while assessing the pain. Because in some cultures, the people will express their pain very loudly. And in some cultures, they will express their pain very normally. They will not express their pain like other people's. આપણે એવું એક્ઝામ્પલ લઈ લઈએ. ફોર એક્ઝામ્પલ અમુક કલ્ચર્સમાં આફ્ટર ડેથ એ લોકો કેવી રીતે એક્સપ્રેસ કરે છે લોસ, આમ એકદમ રડી રડીને ને એવી રીતે. એન્ડ અમુક કલ્ચર્સમાં કેવી રીતે એક્સપ્રેસ કરે છે લોસનો પેન જે છે એકદમ શાંત થઈને, બીકોઝ એમના કલ્ચરમાં એ પ્રેક્ટિસ ફોલો થાય છે. તો સિમિલરલી પેનનું બી એવું જ હોય. This we will study in the population. જે different types of population છે ને એમાં આવું બધું છે કે કયા કલ્ચરમાં એ લોકો વધારે પેન આમ લાઉડલી એક્સપ્રેસ કરે છે, કયા કલ્ચરમાં એ લોકો પેન નોર્મલી એક્સપ્રેસ કરે છે. એ લોકો એવું કહે છે કે પેન ઇઝ ધ સફરિંગ. તમે કશાક બેડ વર્ક્સ કર્યા છે, ડ્યુ ટુ યોર સિન્સ ધ ગોડ ઇઝ ગિવિંગ યુ પેન, સો યુ હેવ ટુ એક્સપિરિયન્સ ઇટ. ધીસ ઇઝ યોર પનિશમેન્ટ. અમુક કલ્ચર્સમાં એવું એ લોકો બિલીવ કરે કે આ ભગવાને તમને પનિશમેન્ટ આપી છે તો તમારે એ સહન કરવું જ પડશે, એ તમારી પનિશમેન્ટ છે. સો ધીસ ઇઝ સમ કલ્ચરલ બિલીફ્સ, ધેર રિલિજિયસ બિલીફ્સ. So you have to always keep in mind while assessing the pain of the patient. Understood?
Yes, ma'am.
Okay. Just wait for a minute. I'll take the attendance. Okay, so now you can leave the class, but Megha and Jayanti, please stay for 5 minutes. Other students can leave.
Thank you, ma'am.
Thank
Yes,
you.
ma'am.
Okay, so Jayanti, do you get the idea of today's class? Are you understanding the points?
Yes, ma'am. Definitely, ma'am.
Okay. Any suggestions you want to give or anything?
No, ma'am.
Okay, what
Everything
about
is
me?
understandable, ma'am.
Sorry, Jayanti?
Everything is understandable.
Okay, okay. Okay, very good. Now you can leave. And what about Megha?
Ma'am, understood.
Okay, okay. So see you tomorrow at 9 a.m. Thank you.
Okay, thank you, ma'am.
Thank you, ma'am.
Thank you.